There are diseases that people hear about in passing, and then there are diseases that feel almost unreal when you actually understand what they do to the human body. Rabies falls into that second category. It is not just an infection or an illness in the ordinary sense. Once it enters the nervous system and reaches the brain, it begins a process that is slow, relentless, and almost unstoppable. What makes it so terrifying is not just the physical damage it causes, but the way it dismantles awareness, control, and eventually the sense of reality itself. It usually begins in a way that seems completely harmless. A bite or scratch from an infected animal may not even feel serious at first. In many cases, people don't think much of it. Life continues normally. There may be a small wound, maybe a bit of discomfort, but nothing that immediately signals danger. This is one of the most dangerous aspects of rabies. The virus does not attack loudly or instantly. Instead, it hides. It slowly begins its journey through the peripheral nerves, moving upward toward the central nervous system. During this time, the person feels completely fine, unaware that something inside their body is already progressing toward a critical point. Days can pass, sometimes even weeks or months, depending on where the bite occurred. The closer the wound is to the brain, the faster the progression tends to be. But during this incubation period, there is silence. No obvious signs. No dramatic symptoms. Just normal life continuing as if nothing has changed. That false sense of safety is what makes the later stages so devastating, because by the time the brain becomes involved, there is very little that can be done. Eventually, the first subtle signs begin to appear. At first, they are easy to dismiss. A slight fever, a feeling of weakness, a sense that something is not quite right, but nothing specific enough to cause alarm. Around the original bite area, there may be tingling, itching, or strange sensations that don't match a normal injury. It is not constant pain, but something more unsettling, like the body is sending unclear signals. As the virus continues to spread closer to the brain, the symptoms begin to shift from physical discomfort to neurological disturbance. Anxiety starts to appear without any clear reason. The mind feels unsettled. Sleep becomes irregular. There is a growing sense of unease that is difficult to explain. The person may feel restless, confused, or emotionally unstable without understanding why. Then comes the stage where reality itself begins to feel slightly distorted. Concentration becomes difficult. Thoughts may feel scattered. Small moments of confusion appear more frequently. There is often a deep sense of fear that does not connect to anything specific. It is not like normal fear caused by danger in the environment. It feels internal, as if the brain itself is generating a constant warning signal. As the virus reaches the brain, everything begins to accelerate. This is the point where rabies becomes truly catastrophic. The central nervous system starts to malfunction. The brain, which controls every thought, movement, and sensation, begins to lose stability. Emotional responses become extreme and unpredictable. Fear intensifies to a level that is no longer rational. The mind starts interpreting normal sensations as threats. Hallucinations can begin during this phase. The person may see or hear things that are not present. Shadows may seem like moving figures. Ordinary sounds may feel distorted or amplified. Reality becomes fragmented, as if the brain is no longer processing information correctly. At the same time, the person is often still aware enough to understand that something is very wrong, which makes the experience even more terrifying. The body begins to respond violently as the nervous system becomes more unstable. Muscles start to twitch and spasm without control. Normal physical sensations become unbearable. Light may feel painfully intense. Sound can feel overwhelming, almost like it is physically harming the brain. Even mild external stimuli can trigger intense discomfort. One of the most disturbing symptoms that can appear is difficulty with swallowing. This is where hydrophobia becomes associated with rabies. It is not simply a psychological fear of water, but a physical reaction caused by spasms in the throat and chest muscles when attempting to swallow. Even thinking about drinking water can trigger these painful contractions. As a result, the body begins to reject one of its most basic survival needs, which quickly leads to dehydration and further weakness. At this stage, the person is trapped in a worsening cycle. The brain is misfiring, the body is losing control, and basic functions are becoming increasingly difficult. Confusion deepens. Fear becomes constant. The nervous system is in a state of extreme overactivity followed by breakdown. Moments of awareness may still appear, but they are brief and often followed by disorientation or panic. As the disease progresses further, the ability to control movement and behavior begins to fade. The muscles no longer respond normally. Some areas of the body may become stiff or paralyzed, while others react with sudden spasms. Breathing can become irregular as the nervous system struggles to maintain basic functions. The heart and other vital systems begin to operate under increasing strain. Mentally, the situation becomes even more severe. The brain is no longer able to maintain stable perception. Hallucinations may become more intense and frequent. The distinction between reality and imagination becomes unclear. Fear dominates nearly every moment. The person may experience sudden bursts of agitation or confusion, followed by periods of partial awareness where they may still recognize their condition. Despite all of this, what makes rabies uniquely horrifying is that in many cases, consciousness is not completely lost until very late in the progression. This means the person may still be aware of their deterioration. They can feel their body changing, losing control, shutting down, while being unable to stop it. That awareness combined with helplessness creates an extreme psychological burden. Eventually, the nervous system begins to collapse more completely. Paralysis spreads further. The brain can no longer regulate essential functions properly. Breathing becomes shallow and unstable. The body starts to shut down system by system. At this stage, survival is no longer possible. The damage is too widespread and too advanced to reverse. The final phase is not sudden, but gradual failure. The nervous system stops coordinating essential processes. Organs begin to fail as the brain loses control over the body. Without intervention earlier in the infection, there is no recovery once symptoms have fully developed. This is what makes rabies one of the most feared viral diseases known to medicine. What makes this entire progression even more striking is how preventable it actually is. A simple vaccine given after exposure, before symptoms appear, can stop the virus completely. But once it reaches the brain, the situation changes entirely. At that point, the disease follows a path that modern medicine cannot reverse. Rabies ultimately reveals something deeply unsettling about biology. It shows how fragile the balance of the human nervous system really is. Something invisible, something microscopic, can enter the body quietly, move unnoticed for weeks, and eventually take control of the very systems that define thought, movement, and identity. It is a reminder that the greatest threats are not always visible or immediate. Sometimes they move silently, waiting for the moment when it is too late to stop them.